Hi everybody, this is Grant and Jasmine from Method Dental. Today we're talking about preferred providers and private health insurance. Now most of you have probably already heard the term preferred provider, but do you know what it means and what it means for your health? So what is a preferred provider?
Well, Jasmine, a preferred provider is a dentist that has signed up with a particular health fund and they charge contracted fees. So the health fund sets the fees, you charge them to patients that are participating with that health fund.
And to be a preferred provider, do you need to have an extra set of qualifications? How are they different to a not preferred provider?
Well, they're exactly the same. To be a dentist in Australia, you need to be registered, and preferred providers don't have any special qualifications that other dentists don't. Basically, they are registered and they sign some paperwork, and the first dentist in a particular area gets the status for preferred provider.
Okay. So based on your description, they're exactly the same, but they're not treated equally by health insurers, are they?
No, absolutely not. Preferred providers must charge contracted fees. So basically imagine that a totally unrelated company comes in, sets your prices for your goods, your services, without knowing what your running costs are. And then the private health insurers, they also provide a bigger rebate to their customers when they go and visit a preferred provider compared to the rebates they give to a patient going to a different dentist.
Right. So as a consumer, set fees and higher rebate. That sounds like a pretty good deal to me, don't you think?
Yep. I mean, if it sounds too good to be true though, it usually is. So what you may gain in terms of reducing your out-of-pocket costs for dental services, you may lose in terms of trust and autonomy. What I mean to say is that if you want to choose your own dentist based on trust, recommendation from a friend or family member, their levels of service, and they're not a preferred provider, then you're out of luck. Someone down the road may be paying the exact same premiums as you, and they'll receive a higher rebate for going to a preferred provider than you will going to a different dentist.
So that sounds really unfair, like it doesn't sound right, does it?
I think it's very unfair, and the Australian Dental Association also thinks it's very unfair to consumers.
So if you've taken everything into consideration and you've chosen a preferred provider because that's best for your health, then that's awesome, right?
Yeah, well, there'd be one final point I'd like to make about extras cover, is that your private health insurance premiums over the last 5 years have risen more than 6% every year. But the amount that you get rebated back for dental services has not anywhere near matched that level. With Australia's ageing population, there's more of a burden on the hospital system, and so big health funds, they need to maintain levels of profit for their shareholders, for the stock market, and they need to find their profit somewhere. So they're basically robbing Peter to pay Paul.
So with everything that's been said, we are preferred providers for HCF. How does that work?
Well, HCF are different in 3 key ways to most other health funds with the way that they're preferred provider schemes and as a company. So number 1, they're members owned. They don't have shareholders like Bupa or Medibank. They don't have to generate profits for the stock market. 2, they set their fees only for diagnostic and preventative procedures, so just on those things, and as a business with our running costs, we can justify taking those fees. And the third thing is that they don't discriminate between different dentists. If your dentist, the trusted dentist that you have, wants to join up to HCF's More for Teeth program, generally they can, because they don't restrict you based on a particular area.
Okay. So in light of all of this, the next time you choose a health professional, think twice about what a preferred provider means for your health.